I'm Alex, and Nicole and I are going to talk to you about angina. Every year, more than 3 million people in the U.S. are diagnosed with angina, which is a reduced blood flow to the heart. Nicole here is going to talk to you about some labs, diagnostics, signs and symptoms, and procedures.
So the most common signs and symptoms of angina are chest pain or pressure. Sometimes it's described as a tightening feeling, or like indigestion and heartburn. A lot of times people have dyspnea or difficulty breathing. If you came to the ER complaining of chest pain, the first thing that they would do is do an EKG to rule out myocardial infarction, and if that was negative, then they would draw labs to check cardiac enzymes and troponin. Some diagnostic testing would be an angiogram, which is when they inject dye into the blood vessels to check for blockages or clots, and a procedure to open up the blood vessels would be a cardiac catheterization, where they place stents in the vessels to open them up. There are two different types of angina, stable and unstable. Stable angina happens only after exertion, and it goes away with rest. Unstable angina could happen at rest and during exertion, and will not go away with rest. It requires nitro or other interventions.
I'm going to talk about the primary form of treatment for nitroglycerin, which is, the primary form of angina, which is nitroglycerin. So just a couple of things. When you go home, they're going to give you sublingual nitroglycerin. So you're going to place this under your tongue and let it dissolve. If you have an onset of chest pain, you're going to take one dose every 5 minutes until the pain resolves. But really important, do not exceed 3 doses per episode of chest pain. And if your pain is not resolved within 5 minutes of taking the first dose, so you are experiencing chest pain, you're going to take 1 dose, you're going to wait 5 minutes. At that point, if your chest pain is not resolved, you're going to call 911 because at that point it is an emergency and every minute is going to count. Also make sure when you take it that you're sitting down because you're very likely to get dizzy if you take it standing up, and you could end up falling over and hurting yourself, injuring yourself. There are some expected side effects of nitroglycerin, so if you are taking this drug and you experience these things, that's normal and totally expected. You should continue to take it. The most common ones are headache, flushing, so like redness in your face, the dizziness I mentioned earlier, and then nausea, feeling sick to your stomach, or vomiting. So aside from taking medication, there are some things that you can do non-medically to reduce your angina. So those are smoking. So if you smoke, stop smoking. A sedentary lifestyle. So if you are not exercising, that puts you at a higher risk. Having a high blood pressure. So there are a ton of medications and other things that you can do to resolve high blood pressure. You should probably talk to your doctor. Diabetes, same thing. Diet, exercise, medication, and excessive alcohol use. So try to cut down on your drinking as well. That's it.